Hello everybody, Dr. Shadi Ireifej here, surgeon at True Care for Pets, Studio City, Los Angeles. This is Vet Talks. Let's pause for a minute where we have an informal look at a topic of the week. And this will focus on how to manage arthritis in your pet. This is specifically for the dogs. We will go into cats another time, a little bit different. But as far as arthritis in dogs, it's becoming more and more of a common issue in pets because they are getting older. Medicine has been getting better and better, and so pets are living longer, and they are more prone to diseases such as arthritis, also heart disease and cancer. So arthritis is a big one. I do get plenty of consults at the office regarding arthritis in dogs and how to manage them. And the first step, of course, is going to be to go through all the typical testing. You're going to meet the veterinarian, your family vet, or myself as a specialist. We're going to quiz you on the history of your pet and perform a physical examination, make sure there's nothing obviously wrong with your pet otherwise, offer some diagnostics, let's say x-rays, CAT scan, MRI, blood work, whatever it's going to be, and then let's say we come to the conclusion that your dog has arthritis. And let's say your dog has arthritis in multiple joints, right? Multifocal osteoarthritis, or degenerative joint disease. So what are you going to do now? Well, you've got several different options, and honestly, polypharmacy, meaning the use of multiple treatment modalities simultaneously, is preferred. You're going to do more than one therapy. So we'll go down the list of what therapies I recommend, and your pet may or may not be a candidate for all these treatments, and you financially may not be able to swing all these treatments. So you can kind of pick and choose between having a discussion with your family, your friends, and of course your veterinarian, what the best route to take is. So the first medication, hands down, is going to be non-steroidal anti-inflammatory drugs, NSAIDs, the Tylenol for dogs, so to speak. There are very specific canine only approved NSAIDs, anti-inflammatory drugs that you can use in dogs. You shouldn't use the ones for people. Those are dangerous and toxic. So you're going to follow your veterinarian's recommendations. But non-steroidal anti-inflammatories, NSAIDs, are the most commonly used medication by far. They help with inflammation, plain and simple, and inflammation anywhere in the body. You have to make sure that your pet doesn't have any history of having reactions to NSAIDs, and you have to make sure that you have recent blood work that shows that things look good, make sure liver and kidneys are okay. Basically, you need to get the blessing of your veterinarian or the specialist before you start NSAIDs in dogs, but NSAIDs are by far the staple treatment for this condition, hands down. Number one, NSAIDs. Number two, medication, analgesics. So non-steroidal anti-inflammatories are a type of anti-inflammatory that we're finding also provides analgesia in animals. It's an incredible class of drugs. But there are other types of analgesics that are also not focused on anti-inflammation. So examples are Gabapentin, which is also known as Neurontin in people. You also have Tramadol, which is a very common one. It's like a weak morphine derivative. There are many, many others that are less commonly used, of course. But analgesics that are not in the NSAID class can also be used in these pets. So Gabapentin and Tramadol, and they probably work synergistically, although we need studies to show that. But in theory, if you are treating inflammation and pain with the NSAIDs, now you're treating pain in general with the Gabapentin or the Tramadol, then of course you expect these things to work in tandem, and that's really good. And they don't really have reactions with each other, so you can safely use them as long as your veterinarian, of course, deems it okay for your pet in your particular case. The third treatment modality is going to be more along the lines of physical therapy. And I'm going to include under the category of physical therapy, laser treatment, ultrasound treatment, as well as acupuncture. And of course, the routine physical therapy. Exercises, underwater treadmill, the hydrotherapy, the dry treadmill, proprioception exercises, stretching, massage, range of motion. And so consulting with a canine and feline licensed rehabilitator, physical therapist, is paramount to this. I myself involve the physical therapist heavily into my treatment options for a variety of diseases, and arthritis being one of them. So I think that physical therapy is becoming, I know physical therapy is becoming more and more widespread. It's a very common treatment modality now. More and more people are investing finances into it, investing time into it. You can perform physical therapy at home as well. There's plenty of videos online, or your veterinary staff or specialty hospitals such as True Care for Pets can teach you how to perform physical therapy. But of course, you want to use that as an adjunctive treatment option to actual physical therapy by a rehabilitation center. So physical therapy is huge. It helps keep the joints in motion, helps keeps your muscle build up, helps keep the nerves healthy. So, and of course, there's also weight loss programs they can use to try and shed the weight off. And that brings us to our fourth treatment option, which is going to be exercise modification. So you don't want to force a pet that's arthritic to be active, but you also want to promote joint movement, muscle growth, nerve health. You want to promote weight loss. And so you're trying to find a balance between how much can I push my pet and lose the weight and also keep their joints healthy, but not make them do something that's painful for them or uncomfortable to do. And there's a fine line here. It's an art more than a science. You're going to want to work in conjunction with your family veterinarian and the physical therapist especially to see what your pet can and cannot do. Your physical therapist will then be able to modify any physical therapy you're going to be able to do at home, as well as modify the exercise regimen that you have for your pet. There are some pets that can do a lot, just like there are older people that can do a lot, and there are some pets that can't do very much, but you want to make sure you get them moving and also do it safely. So exercise modification is a big one. And then our fifth one, which you've already alluded to now in the previous two, is weight loss. Weight loss is its own category because although it plays a role in physical therapy and exercise modification, some pets just need to lose the weight. And if you're a person who's lost weight, you can probably attest to how successful weight loss has been on overall health, your endurance, energy level, your joint mobility, your mindset. Weight loss is huge. And so you can consult either with the physical therapist, your family veterinarian, or there are actually companies, dog food companies that may even offer nutritionalists for animals. Believe it or not, they're actually veterinary nutritionalists. You can also check out local veterinary schools for that information as well. And there are ways you can modify the diet that your pet is on without feeling like you're starving them, because nobody wants that. But there are ways to lose weight healthy. There's also, besides diet modification and exercise modification, there's also actually appetite suppressants for dogs that can help subdue their hunger. And of course, you want to use these modalities safely. But weight loss is a huge factor to it. Obviously, this only pertains to those pets that are considered overweight or obese. Right, we're not talking about the ones that are already lean muscled and fit. This is for the ones that are thin. This is for the ones that are obese or overweight. So those are my five top. You've got number 6, which is surgery. There are surgeries sometimes we have to perform on pets. We can do joint replacements. We can do joint removals. We can fuse the joints. There are times you can clean up the joints with scoping procedures. There's a variety of surgical options. There's of course also amputation as well. If you have one leg that's really bad and your pet can handle walking on 3 legs. So there's a variety of surgeries. I'm gonna leave those for another time. This is gonna be focused on really those pets that are not going to they either are not candidates for surgery because they have multifocal arthritis, meaning in more than one joint, or you as a pet owner don't want to perform surgery, or your veterinarian doesn't recommend surgery, or the surgeon doesn't recommend surgery, whatever it is. That's a whole different discussion. But surgery would be your 6th option should you choose it. And keeping in mind, of course, this list of treatments are not in order of importance. This is just an order. The importance is going to be based on you, your pet, your veterinarian, what you guys think. And I guess there is probably a 7th option, which is euthanasia. There are some pets, despite your best efforts, are just suffering. They have lived a long, healthy life. They have multifocal arthritis. You've tried everything. Or you have a pet who can't handle the medication safely, or their demeanor is such they can't handle physical therapy. They're not eating because they have other health issues or whatever's going on. And so sometimes euthanasia is your only option. And it's fair enough. That, again, is a discussion to have between you, your family, your friends, your veterinarian, and so forth. So that's my list of treatment options for pets that are older that have multifocal arthritis. Please leave any comments below, any questions, and subscribe to the channel. Thank you so much for listening. This is Dr. Ireifej, True Care for Pets, Studio City, Los Angeles. Vet Talks. Let's pause for a minute. Take care.